Well, good evening. Good evening, friends. Thank you so much for joining us here on Facebook with the Kansas Children's Discovery Center. My name is Laura Burton. I am the Director of Marketing here at the Discovery Center, and I am very excited to be joined by another fabulous Laura. You have two Lauras tonight. What a treat here on Facebook. This is Dr. Laura Vaughn with Vaughn Pediatric. Say hello, Laura.
Hi, everyone. How are you tonight? Thanks for joining in.
We are so lucky to have Dr. Vaughn here for our live Ask a Pediatric Dentist segment. So you heard it right. You get to ask Dr. Vaughn your questions tonight. We have some that have been submitted in advance through Messenger, and we're also happy to take them on the comments. So comment right below. We'll see those questions and we'll get those for Dr. Vaughn. If there is anything that you would like to ask a pediatric dentist, she is here to answer your questions. It's a great opportunity to do that. So while we are getting warmed up, let me tell you just a little bit about Dr. Vaughn. She is a board-certified pediatric dentist, and she's been working with children for a very long time. She's practiced general dentistry in a number of different settings, but then she realized that children make the very best patients, so came over to pediatric dentistry, and she is very excited to be here in Topeka at Vaughn Pediatric Dentistry, using her training to serve local children, educate parents. She's very passionate about children's dental health and making sure we're reaching caregivers with great information about how to keep our kids healthy, starting with their teeth. She enjoys, when she is not working, reading, training for fitness events, and traveling with her two kiddos and husband. You can learn lots about their work and everything you want to know about Dr. Vaughn on her website at biglittlesmiles.com, or you can ask in the comments if there's anything specific you want to know. Dr. Vaughn, one thing that people really love about her, and she's pretty famous for, is telling terrible jokes. Dr. Vaughn, do you want to tell a terrible joke for us to get us started? How does that sound?
Well, I would love to. Usually what we'll do at the office, we have the joke book, 365 jokes for kids. So Laura, I'm going to ask you to pick a number 1 to 365, and we'll see what we come up with.
Oh, man. So the Discovery Center is going to celebrate our 10th birthday next year. So let's do joke number 10.
All right. Going at the beginning. That's usually a sure bet. So let's see. Where is a rabbit's favorite place to eat?
Ooh, favorite place to eat. I'm sure the favorite food has to be like carrot cake, right? Favorite dance has to be bunny hop. But favorite place to eat? I don't know. Tell me.
Oh, stick with the hop. The hop is key because it's IHOP.
IHOP. Nice, nice. Man,
so anyone who brings me jokes gets extra prizes.
You are tuning in to be able to ask a pediatric dentist your questions live, and you just got a really terrible joke with no charge at all. That's pretty great. So Katie Huffman is tuning in. Thanks for tuning in, Katie. She doesn't like. She says, "Oh no, someone please take the joke book."
Katie gets the joke book a lot. She's not a fan of the joke book, so.
We also have Kathy Dameron tuning in. We're so happy to see you, Kathy. Kathy's done a few of these live segments as well. She's been doing yoga, and Kathy says Dr. Vaughn is awesome, and she's totally right. So we're happy to have all of you tuning in. Feel free to share your comments just right below here, and we will get to your questions. But one question I had coming off of your bio, Dr. Vaughn, it mentioned you're a pediatric dentist. So what is the difference between, and this is relevant for me as a parent when I'm trying to figure out where to take my kiddo. What's the difference between a pediatric dentist and a family dentist?
That is a fantastic question to start with. So I worked as a general dentist for a while, and there are multiple general dentists that see kids that are very good with seeing kids. But there are some nuances with children and children's teeth when they need to see a specialist, whether they have cavities at a really young age, or growth and development issues, or just kind of more kid-friendly things for kids that are super scared or different things like that. So a pediatric dentist is 2 extra years of training after dental school. So I actually, after working for 4 years, went back to school for an extra 2 years of training. It's kind of a different, similar to the difference between a family doctor and a pediatrician. There's just more training involved. And then on top of that, we can get board certified, which is going above and beyond, kind of getting extra continuing education and training courses to make sure that we stay current on trends and guidelines that are happening in our profession and career. So,
okay. So that extra training has to go a long way when it comes to serving little kids, who I know going to the dentist, I've got a 6-year-old and a 2-year-old, and Dr. Vaughn is their dentist, of course, and going there can be scary for kids at first. So I'm sure that extra training goes a long way. So friends, again, feel free to ask questions. We have lots that have come in through Messenger, so we will get to a few of those. And one thing that a lot of folks are very interested to know is, Halloween is coming up, and Halloween, of course, involves lots and lots of chocolate and candy and sugar. That's part of what makes it fun. So do you have tips for parents on how they can let their kids enjoy the holiday, but also do some things that are good for their teeth?
It's like anything else in life, you got to balance it out. Halloween's one of those times that candy is key. You've got Halloween and Easter candy, and it's not that kids can't ever have candy. It's kind of part of what makes the tradition of the holiday fun. But you have to balance that out. If you're going to let them have candy, you definitely got to make sure you brush your teeth that night. Maybe add in rinsing with water after having some candy. Maybe add in a fluoride rinse that night. Get in there yourself and supervise and scrub their teeth and kind of make sure that everything's nice and clean, especially after eating that candy. I know in my house, my kids will get so crazy for the next few days following Halloween. It seems like Halloween's fine and they're all crazy. And then the next few days, that candy bowl sits there as just this ominous thing that dominates our life and our house. And their behavior just goes down the tubes. So we try to pick out a few pieces that they really like. They have to earn it. If they don't get it. And then after a few days, we try to donate it or give it away or just get it out of the house and say it's not worth having around anymore.
You sneak it out in the dead of night.
There are several places, trying to make something beneficial out of it. Generally, there's no people that actually need candy, but there are places in town, a lot of dental offices in town will do candy buybacks. We try to make it to instill some good in giving away that candy. That's something that's very near and dear. They earned that candy. They walked around those neighborhoods and they put on the costumes and it's theirs. But, you try to raise kids with good ethics and good morals, and you can get a good plug to do some donating to people and they get something back in return. We'll do $1 per pound or, a token per pound, and they can get a toy out of our toy tower or something that's incentivizing them to get the candy out of the house because they don't need it after a few days of it.
That is solid advice on a tricky holiday. We have a question from, I think, a big fan of yours. Here I have Matthew Vaughn, don't know if there's any relation, who is asking specifically, what is the best candy? I don't know if he's asking for your dental expertise or your individual opinion. I'll let you interpret that either way.
Not sure about that. The right answer, there is no right answer. Anything with sugar in it is generally bad for teeth, but anything that's going to get stuck in your teeth is worse for your teeth. So I don't know if anyone's ever tried to get Oreos or Cheetos out of their kids' teeth. I mean, you could be scrubbing for days. So certain foods tend to get caught in those grooves and in those crevices and all around those teeth. But in general, anything gummy, sticky, chewy, it's worse. Chocolate maybe tends to be a little bit better, but we do fight over the Starburst in our house, though. So I think he would say the pink Starburst are definitely better.
I'm with Matt on this one. The pink Starburst are the best Starbursts. Those are delicious, but not the best candy. I mean, you can do better in candy, but if you got the bag of Starburst, you got to go for the pink. You got to do that.
I think that is a personal preference. Everyone is entitled to have their favorite candy. That doesn't mean it's the best or worst for their teeth, though.
Okay. We mentioned Kathy was tuning in a little while ago, and Kathy has I think this is an interesting question from Kathy. What are the most surprising things parents learn about their kids' oral health needs? So that's an interesting one. Is there something in particular you talk about in your office that many parents are surprised to hear?
That's a great question. I think it just depends on the kid and the parent and their situation. A lot of times we can take the first visit, for example. We'll talk a lot about positioning the children, and it seems really simple once you see it. We get to ask, how am I supposed to brush my kids' teeth? They're moving all over the place, and it's kind of like arm wrestling a bear to get a toothbrush in there. There's no way I'm going to be able to do that. You need to kind of set yourself up for success. And we look at the kids' teeth lying down. So why not take that and try it at home as well? It does a few things. It gets the kids used to lying down, so it's not quite as intimidating when you come into the dental office. But it also gives parents a really good setup to get a toothbrush in there. The more you stabilize their head, they can't pull back from you. I think, Laura, we sent you a picture of that. That would probably be a good time to pull that up. So this is an example of kind of what we do at our first dental visit. We'll do what's called a lap exam, and we'll have the child holding hands with the caregiver or parent and kind of make it as comfortable as possible and get in there and get the child used to brushing their teeth. And I think parents are really surprised sometimes at how well their children do and how receptive they are. It is not perfect. I mean, we have 1, 2, and 3-year-olds in there, and sometimes they're just not very happy, and they cry. And but a lot of times we can get a really good, comfortable visit with this. So I think that might be a good example of what parents are surprised at. The dentist doesn't have to be a scary place. We really try and make it as positive as possible because we're trying to make kids happy and healthy about their smiles and their health care.
Well, that's great information. And yes, that is the sweetest picture. You can see little kiddo there is cozy. I really thought when my kids first visited the dentist that it was going to be a scary situation for them, and it was not. They came back very excited and talking all about how they got their teeth tickled, and I think dentists do a great job creating comfort for kids. So that photo is a great example. And that kind of segues into something that was surprising for me as a parent, something I didn't know before I had kids. I didn't realize how young kids should visit the dentist ideally. So I'm sure we have parents out there like me who are a little bit ignorant of that. What age should a kiddo have his or her first dentist visit?
So this is a great question that we get asked all the time, and I think this is another perfect example of information that parents are surprised at. There's so much different information out there. Pediatricians will say one answer and general dentists will say another answer. The guidelines for the American Academy of Pediatric Dentistry say that within 6 months of the eruption of the first tooth and by no later than the age of 1. So that is the recommendation by the Academy of our specialty. And we certainly encourage and hope that kids come in. A lot of that visit, I'll have parents say, "Are you kidding me? What are you going to do with my 1-year-old kid? He doesn't even have a tooth in there." And sometimes that's the case, but it's acclimating the child to a new environment. It's introducing the parent to expectations for what home care is. It's kind of this idea of providing what we call a dental home. And you'll hear that a lot in our profession. Because we do really want to create positivity and prevention of cavities and really ensure that the best oral care can happen. And that a lot of times starts at home when the children are really young. We'll get kids in at 2 and 3 and 4, and you'd be really surprised sometimes at how many cavities and how big the cavities can be. And it's just because parents don't have access to that information or they weren't given the proper information. And so a lot of that information is what we try to get out there and give to parents. And so those first visits are really just information visits. Yes, we'll go into that lap exam position and kind of get in there and get the child used to the toothbrush and get used to a strange person looking in their mouth. But a lot of it's to make sure that home care is going okay and doing the things that are at home that are right, which is a great kind of segues into some of your other questions too. One of the things that we talk about home care, it sounds really simple, but I think one of the number one things that you can do for your kid is to go to sleep with clean teeth. And we have a lot of people that come in that are really struggling with that bedtime snack or that bedtime bottle or night feeding. And that really can set kids up for some high risk for cavities. And that's when we see kids with a young age at cavities, a lot of times there is linked to that overnight feeding. So, and then when we get questions about that, I tend to, one of the reasons that I reached out to Laura to set this up is because I had been listening to some of the other podcasts that Discovery Center has been doing, which I think is great and wonderful. And you guys have done such a nice job with this. But I got on with the sleep study with Amy Howe and the PEDS associates with Dr. Nelson and Dr. Gamma, and all of that information out there is great. And so there are resources out there to say, how can I get my kid to sleep? I can't get him to sleep without nursing in the middle of the night or bottle feeding in the middle of the night. But one of the things that we like to say is that the kids once children are introduced to solid foods, they tend to they don't require that overnight feeding quite as much. And that's when cavities can start to become more problematic, is when we introduce the solid foods along with the formula. So really getting in and brushing those teeth before bedtime can be really important in terms of preventing those cavities from happening. It's not easy to do, especially, I've been there. I tell people that my husband had to hold me and restrain me from going in, and a crying Nolan in the middle of the night who he wanted that bottle. But for us personally, it took maybe 2 or 3 nights of that. And then it was incredibly better after that. And everybody kind of thrived from that perseverance of kind of getting rid of that overnight feeding. It's hard. We understand. We try to be your cheerleaders, but.
And we're of course, both Dr. Vaughn and I and most of the people watching are very empathetic to sleep struggles. Anyone who's a parent has been. And that recording, by the way, the Ask a Pediatric Sleep Consultant that we did with Amy Howe is still available. That's on our website. So if you missed that one, feel free to go check that out again. She had great advice, and she's available to answer questions as well. We have another question about a kiddo who's probably about a year. This is from Angie. She's saying, my 11-month-old, oh, look at that cutie in the picture. I love it. My 11-month-old has started grinding his teeth. Is there a way to stop this? Or is that
grinding
problematic?
Say that again.
I was just is that a problem? Is that a normal developmental thing that I feel like a lot of kids do that. That seems pretty common.
We hear that a lot, and there doesn't seem to be a one true answer to that. My personal theory, after doing this for however long I've been doing this, is that kids tend to exert energy into places when they're going through some kind of stress, whether it's an emotional stress or a physical stress. Kids are growing constantly. And so when they go through those growth spurts, sometimes that's where that energy comes out to, is those muscles in the jaw, and it ends up grinding or bruxing. So that's kind of what what I seem to find with my kids. We see it a lot in the 6 and under crowd. And once the permanent teeth start to come in, we see it taper off a bit. Now, that is not a tried and true stereotype by any means. Every kid's a little bit different. We will see grinders that really persist into late teens or adulthood even. And that's a little bit where that emotional stress starts to come more into play than the physical stress. There's not really much we can do to treat it. Typically, as an adult, you would think if you grind, you would introduce a night guard in there. Well, a kid's not generally going to tolerate a night guard. And if you it's going to restrict their growth. So it's actually contraindicated to do something like that.
Okay.
Most of the time we say they outgrow it. They're typically not doing any damage to their teeth, and those that they are, then we start to have a more individualized discussion about what we can do to help with that problem. But I was going to say something else about it. In recent years, there's been this discussion about whether grinding is linked to airway issues. And so I will bring that up from time to time with parents that, make sure that they have an airway evaluation with their ENT or their pediatrician, just kind of keep that information in the back of their mind. If they're not sleeping very well at night, sometimes, again, it's just that stress on the body. If they can't breathe, they can't stress, that's where they're putting that energy, and that's where they're releasing it, is into the grinding. So just something to keep in mind for the really persistent grinders. With sleep apnea, there does seem to be that link. It's not technically evidence-based, but it does seem to trend that way. So typically they outgrow it, and we don't really see too many problems with it, but we get a lot of questions about that, and it's a fairly common phenomenon. I will say with my second child, she started grinding for quite a bit, and I just have, every time I heard her do it, I just kind of squeezed her cheeks together and said, stop. And eventually she stopped. So I know it's not always that simple, because half the time they don't know they're doing it, but it's a habit. It's something to be aware of. You call attention to if they stop.
Okay. Well, that's a great tip. Barbara Bordzero, welcome. Thanks for joining us. She says Barbara. Dr. Vaughn taught us all about flossing, and it makes such a difference. Yes, that is such good information. Good tip, Barbara. We're glad you tuned in. I think the first time I had a dentist tell me I needed to floss my child's teeth, I just stared at them like horrified and thinking, how am I going to do this? Now, when we've done it, it gets easier, but what tips do you have for that parent that thinks like, oh my gosh, flossing my child's teeth, that it can be challenging.
It can be. That's one of my it's kind of one of my goals in life, is to get everybody to floss. And it's a healthy habit to have. I mean, I didn't floss my teeth for a really long time, and I paid the price for it. I've had several fillings. I've had a lifetime of dental care. And it really wasn't until I decided, hey, you know what? I'm going to actually be consistent about flossing. And you know what? I really haven't had that many problems since. So that's my own personal take on it from my experience. Yeah. But I think it goes even deeper than that. I think kids really benefit from consistency. If they can have a consistent routine every night, they can get not only the brushing, but the flossing as well. It just sets them up for success. And anything else that you do in life, there are going to be days that you don't want to do it. There are going to be days where it's super easy, and there are going to be days that it's not super easy, but it's just making the effort as much as possible and trying to do it every day. That's what I try to focus on. I get parents look at me 3 ways sideways when I tell them that they have to floss their kids' teeth. I mean, it never fails. But the truth of the matter is, once those teeth start contacting each other, the toothbrush doesn't fit around it. And if it's not getting cleaned off, that's where cavities can happen. So kids that have their 2 front teeth touching, it's a great place to practice. You can get them used to that. And then as they get older, their back molars will touch. And that's where we see a lot of cavities happen. And those are the areas that we kind of stress flossing. The little floss pickers, I mean, they're not perfect, but they are way better than nothing. And it's a great tool to be able, it's a good stepping tool to be able to move up to actual floss. There are a bunch of different tactics out there on the market. There are these really cool tools called gum chucks that we used in my house. They didn't catch on quite as well as I wanted them to. They're not very cheap. They're kind of expensive. But my kids had a blast trying to shoot the nunchucks into the trash can every night, and it became kind of a game. So honestly, like anything else, whatever makes it fun for your kid, whatever motivates them. I learned in dental school, one of my professors told me to floss before brushing. And this is kind of one of those questions among dentists. How many dentists recommend brushing before flossing or flossing before brushing? And honestly, I don't think it matters as long as you're doing it. But what got me to start flossing was to pick up the floss first, because it just holds you accountable. You know, I'm not gonna floss my teeth and then not brush. That just doesn't seem like, you're not going to walk away without brushing. But if you brush first and you're like, I don't really feel like flossing, you're going to be a lot more likely to kind of walk away without doing that.
That is so interesting. Yeah.
Yeah. And the other thing too is that, I just had a thought and I lost it. It was probably about flossing the dance. You know, we really liked the floss dance for a while here when that was popular.
That's great. Is that not still popular? I'm out of touch. See, to me, flossing is still new and hip, but I don't know these things.
It depends on the kid and the music that they're playing. But yeah, we still do see it from time to time.
That's a diplomatic way. Great question here from Karen. And I know you get this question a lot. We've gotten this question a number of different times tonight from different folks. How long can your child be a thumb sucker without messing up their teeth? And we had a parent ask specifically about braces and links to orthodontia. And yeah, give us the scoop on thumb sucking.
We could have an entire podcast about sucking habits, whether it's a pacifier or a thumb. Or sure, I'm free. Just book me. But the short answer is, when they're young, a pacifier or a thumb is there to pacify. It's to do exactly that. It's a self-soothing. It's a natural thing that happens with babies. And as they get older, generally around 2 or 3 is when we start encouraging them to stop. Now, obviously, that's a lot easier with a pacifier than it is for a thumb or a finger. You can't really throw out a thumb or a finger or cut it off or modify it quite as easily. And I have had some parents tell me that they've thrown away the pacifier and the kid has switched to a thumb or a finger. That doesn't happen very often, but it depends on the kid. You know, some kids need that soothing mechanism to be able to cope. And then it depends on what's going on in the life. You know, if there's divorce or moving or changing school districts or, you know, whatever emotional is going on sometimes, or there's a new sibling in the house and you just got rid of the toddler's pacifier and now they want baby brother's pacifier. Yep. So we'll hear that happen. The short answer is that once a kid can start talking, you take it away when you're in public, use it when you need to, when they're upset or they're sleeping. And then as they get older, if they're really still stuck on it, then there's more psychological, behavioral things that can happen. And I always tell parents, as long as you're aware of it and you're making an effort to get rid of it as much as you can, depending on the child, that might not be the battle that you want to pick, because I bet if that's stubborn about a thumb or a finger, there's other things that child is stubborn about as well. But I can tell you that I happen to be a thumb sucker for a lot of years. So
you heard it
and
first.
If you come into the office, I have been known to admit how old I was when I stopped sucking my thumb. So there is hope for everyone out there, because there's always braces, there are always appliances and things that we can do once they get there. But the goal is that once the permanent teeth come in is really when you want to start making sure that sucking habit is eliminated, because that's what's ultimately going to affect the permanent bite and the permanent dentition.
Mm-hmm. Great.
And I know for a fact that she had some experience with that as well.
Gotcha. This next question, I think this is a really awesome question. Answer it as if you've got info on it. We can also refer her to some other resources if needed, but I want to throw it at you to see if you've got thoughts. Kendra is asking, how can I help my autism or her son who has autism enjoy brushing his teeth. And this is, of course, a really diverse population. So it's always tough to extrapolate or to guess. I wanted to throw it at you. Any thoughts for her?
Autism is definitely challenging, and that's something that we try to work with. But a lot of that comes from home care and consistency at home. And a lot of kids have either an occupational therapist or a behavioral therapist, and brushing is just one of several other things that need to get worked on in terms of those daily habits. Some kids are really, really orally averse to anything in or near their mouth. And so the more, again, same that I've said before, the more consistent you are with insisting on doing it every day, desensitizing those kids to a toothbrush, trying to make it seem non-threatening, and just making it fun and motivational. I wasn't set up for props with this, but we do have, a lot of times we'll show our autistic or behavioral kids that really, really struggle with toothbrushes. There are different toothbrushes that are out there, and sometimes we'll show this one. It's called Surround. They're available on Amazon. They're not cheap. They're probably about $10 a toothbrush. But what they have is they have an angled brush head. So instead of trying to get all three surfaces, you just have to go straight back. And so sometimes it can give parents a little bit of a helping aid to be able to do this. And we do hear good feedback about that. So I think a lot, it's gosh darn hard work. But sometimes getting dressed in the morning is a challenge for these kids, and we understand that. So I think just that you're aware and you're trying to keep them as clean as possible, and we try and work with them. Some days they're receptive to coming into the dental office and having us look in their mouth, and some aren't. But again, that's where those early visits come in handy, and getting kids used to being in this environment and kind of acclimating to weird people in their space and in their teeth and all those kinds of things.
That's a great answer. Thank you so much. We've got a question here we have a couple of questions about cavities. One of them is from Courtney. She's saying, are cavities genetic? I've heard this too. Can you give us the myth and fact, Skinny, on this? Do people get cavities because of genetic markers? Is it nature or nurture with cavities?
That's a tough one. We don't actually know the answer to that. I don't think specifically that they're genetic, but we will see it trend in families. How's that for a PC answer? There are several hundred different kinds of bacteria in your mouth. So sometimes you'll hear dentists say that the mouth is the dirtiest place in your body, which is surprising to some people. There's another answer, Kathy, to facts that parents are surprised at. Your mouth is a really, really dirty place. And so what we share from family member to family member isn't necessarily the genetics, but it's more the bacteria that we share between family members. So if a parent or caregiver has active decay or active cavities in there, and we have a spoon or a straw or, any way that they can transmit that saliva from parent to child, they will tend to pick up those cavity bacteria causing bacteria that tend to make them more at risk. Oh, wow. So similar to catching a cold, but not really. You can't really catch cavities, but you can have certain risk factors that make you more susceptible to getting decay. And when you have those risk factors, you just have to work that much harder at the brushing and the flossing and making sure that you're not eating all the Halloween candy throughout 365 days of the year. And sometimes it's just plain gosh darn bad luck, What I will say, though, cavities aren't necessarily genetic, but we will tend to see there are different tooth anomalies. Some people have missing teeth. Some people have extra teeth. There's another thing that parents are surprised at. Kids sometimes don't have their permanent teeth. And that tends to be a little bit more, I struggle to say genetic because we don't know that for sure, but it does tend to trend in families. If a parent is missing a tooth or an aunt or a sibling, a lot of times kids will miss or have an extra tooth in there as well. So yes and no.
I love that answer. I love it. Yes, I still have a baby tooth, Dr. Vaughn, because I don't have a permanent tooth. So I'm still holding on to one baby tooth over here.
Yeah.
And
So that's
I'm
why it's
interested
so
in the
important
comment
to take
weigh
care
in
of
on.
those teeth. Mm-hmm.
It is. I feel like I should get tooth fairy money with interest when this comes out from my parents. My parents disagree. So commenters weigh in on whose side are you on, me or my parents? When I lose a baby tooth, am I still owed something? What do you think?
I feel
Weigh
like
in.
if you've been able to keep it
once
for
you
that
decide-
long, I feel like if you've been able to keep it for that long,
something.
you're definitely owed something. You know what you're getting? You're saving the money on an implant. That's what you're saving.
Yes, the tooth fairy will not cover that. Let me tell
No.
you. You kind of answered this question, so I thought I'd pull it up a little bit from Marissa, who was asked, "Can you share cavities?" It's sort of what you were just talking about in terms of being able to share bacteria.
Correct. Yep. So we really.
So anything to add for her on that? Yeah.
Not necessarily. I think just being aware that sharing straws or sharing spoons or sharing toothbrushes or anything like that, just really try to minimize that, because you do want to prevent that bacteria transfer from one kid to another if they are at risk of getting cavities.
Mm-hmm. Great tips. We had, and she posted this back when we were talking a little bit about flossing and different products. Katie said, Cocoa Floss. What, do you know this? What is this?
We do know this. We sell this in our office. So Cocoa Floss,
okay.
there are a lot of different options out there. You know, I go back and reference one of my professional school all the time, and he would go around telling people, you know, there's this really great product out on the market that it improves your health. It prevents cavities. You only have to use it for 30 seconds a day, and it costs you like $3 a year. And everyone's, oh my gosh, what is it? I want to use it. And it's Floss. So it's just, it sounds, when you break it down like that, it doesn't sound that difficult. And so we don't know why it's that hard to get the floss in there. But there are a million different toothbrushes out there on the market. There are a million different toothpastes out there on the market. There are a bunch of different floss options as well. And really, it's just personal preference. Cocoa Floss it's marketed as an exfoliating scrub for your teeth. So it has a little bit of that spa quality for it. And they have good flavors, and it tends to be a little bit thicker and grabby. So it's really getting in between and cleaning up all that film of gunk in between your teeth. So it's not the $3 a year. It's a little bit more expensive than that. But I will say that my kids have now graduated from the gum chucks to the Cocoa Floss, and we have fights about who gets the pink Cocoa Floss in my house. So they must be doing something right because they like it. Yep, it's a good floss.
Oh man, that's awesome.
Dentist approved.
Well, way to go, Cocoa Floss. We like them. That's a nice plug. I feel like they should send us a check. That's what I think.
Right? I agree.
So Katie followed that up with a really good question here. How old do kids need to be to start flossing or brushing their own teeth?
This is another thing, Kathy, you know, I'm really glad you asked that question all the way in the beginning, because I keep coming up with answers that people are surprised with when they come in the dentist. And this is one of those. We generally recommend that when a kid can tie their own shoes or write in cursive, which is harder now because we don't teach cursive in school quite as much. But when kid can tie their own shoes, they can generally have that manual dexterity to brush their own teeth. We hear all the time that 2 to 3 year old range, like they just want to brush their own teeth. They don't want me to help them. They won't let me brush their teeth. And that is very, very normal. You know, 2 and 3 year olds are trying to exert that independence and do things on their, they want to do everything on their own. So of course they want to brush their teeth on their own, but they can't get some of those spots that is required to get back there. And so they can brush their own teeth. We recommend supervised brushing until they have some of those manual dexterity skills to be able to get to all those hard to reach places. And still spot checking, even if they've had cavities in the past, we still recommend spot checking, sometimes even longer if they're not getting the plaque off the teeth.
Right. Yeah, that's great information. We also have, this is a great one from Ashley. She said, how often should toothbrushes be replaced? I wonder, is this different for kids and adults? Adults, I've always thought every 6 months. Is that the same for kids or different?
We tend to knock it down a little bit more towards 3 to 6 months. And a lot of that reason is because I don't know if you've ever watched your kids brush their own teeth, but they tend to chew the they tend to chew on those toothbrushes pretty hard. So, mine are in there grinding away on there. So if you see those bristles that are just flayed and sprayed and out, if it doesn't look like it's going to be doing a very good job cleaning your kids' teeth, it's probably not. So, as a general rule, every 3 to 6 months, but also as needed, depending on visibly how that toothbrush is looking. And then, if the dog gets it, or it falls in the toilet, or any other amount of places that the toothbrush can end up. I have had people ask me, I was just gonna say, I have had people ask me if they can put it in the dishwasher to kind of revive it.
Oh, interesting.
I've never really come up with a good answer to that. I mean, I've never tried it myself, but I suppose that as long as it doesn't melt in your dishwasher, it's a cleansing cycle for it. I would just grab a new toothbrush, but that's me.
But you do you. Right.
Exactly. If that works for you,
well,
then
great question. Whatever brings you joy. Awesome questions so far, friends. Keep them coming. Feel free to post your questions in the comments below, and we will get to those. We've got some more that have come in from Messenger. One question, I know you get this a lot in the office, and we got this coming into this program. Do you have parents, when you are seeing kiddos at the office, do you have parents come back with their kids for the visit? Do you prefer they stay in the waiting room? Why or why not? I know that's something parents discuss a lot. So give us your perspectives on that.
It is. I got asked this question in my interview for pediatric residency, and it was a challenging question then. And you know what? It's still a challenging question today. I don't think there's a right or wrong answer to this question, but it is definitely a conversation, and it's a very heated conversation sometimes. So pediatric dentistry, there is this triad between a parent and a patient and a doctor. So you can imagine that extra person is a lot more complicated than just a doctor-patient relationship. You have extra opinions and there's just more. But it's really important. I don't know whether anyone has ever paid attention or noticed, but my primary focus is typically on the child. So if I go into a room, I tend to introduce myself to the child first and try to engage in a conversation and start a relationship with the child. And you'd be surprised at how many parents will just jump right into that conversation and answer for their kids before even allowing their child to have a chance to answer for themselves. And I don't think it's on purpose. I don't think parents even realize that they're doing it. It's just this natural protective quality that we have to be able to provide for our kids. So, but it can be definitely complicated for that matter. And every kid is different, and every family is different, and every office is different and have different opinions on how to go about this. So generally speaking, with younger children, we invite parents back to come see how the office is set up, how we interact with the children, and things like that. And we try to really accommodate as many requests as possible. But everything that we do is with the child in mind and with safety in mind. And I've worked in several different offices in several different scenarios. And in terms of exams and cleanings, we'll have parents back, but we tend to not invite parents back when they're getting treatment done. And I think it's a really good opportunity to point out some of the reasons why we do that. Mostly it's for safety. We try to optimize safety and minimize risk. And when you invite another person into that scenario, I can tell you different times that I've had parents trying to help, but they'll walk over, and as I'm working, you got to remember, I've got a drill going that goes rotates 4,000 times per second in a tooth or in a mouth. And It can really damage things if it doesn't go where it's supposed to go. And if you're coming over to comfort your child and hold their hand and you accidentally step on the foot pedal that moves the chair while I'm working, it's not a safe environment to be in. And so other than just the safety aspect, we've had parents pass out or faint in the operating or, in the procedure room. And that's distracting me from caring for a child and optimizing that safety for them. But then, the other thing is we want the child's attention to be on the provider, and children are naturally going to go to their parents first. And sometimes I need them again for that safety procedure to focus on me. So there are so many different factors that kind of go into there that parents may or may not consider. But like I said, every situation is different. We really try to accommodate people as much as we can. Obviously, COVID has made that very, very challenging. We are still trying to limit as many people in the building as we can as possible. I don't have a mask on right now, which is probably the first time I've ever been in the office since May without a mask on, but I'm the only one here right now. So, but we are fully masked. We have double mask and hats and face shields and everything to try and be safe and be protective for people. So in general, kind of a general scenario, if your kid's old enough to go to school by themselves, we tend to try to encourage them to come to the dentist by themselves. Obviously, younger children, parents want to come back with that, that's fine. But we understand that everybody has different ideas and different opinions, and ultimately you have to trust your provider. And we try to honor that, and we also ask for respect for our policies as well, because they're in place for a reason.
Great answer. That's a lot of good information. I think that
it's a hard question.
I think there's a lot of pieces of that the parents can think of. Yeah.
Right. Yep. I mean, it's not all fun and games.
Absolutely.
Sometimes. What we do is it's not fun to have cavities fixed. So we try to make it as fun as possible, but sometimes it just stinks.
Oh man, it's a good way of putting it. So we have this question from Anna, and it's getting cut off here.
Anna.
So I'll read this one. She said she has a two-part question, and this is similar. It reminds me a little bit. We were talking a bit about pacifiers and overbites, and so Anna, if you caught that question, great. If not, you might go back in the video once we're done and check that one out, because I think that information will be helpful. But she's saying, my almost 3-year-old daughter has an overbite. Could this be because we just took her pacifier away that she's been using during rest times? And number 2, how concerned do we need to be? And she adds, thanks, Dr. Vaughn. So 3-year-old with an overbite, is that a concern? Could that be?
I think if the habit is removed, you can stop worrying. You can start sleeping at night. You don't have to really, once the habit is removed, you're giving the child the best option of being able to grow out of it, or, have the growth be maximized to give them the best possible positioning for those final teeth. Kudos to actually taking it away. It's a hard thing to do. So, especially when you've got a younger one in the house. Yep, it's hard.
Empathy for Amy and all the parents out there getting their kids off passies. It's tough. It is really tough. And kids are so different. My daughter was just wedded to her passy until she was about 3, about that same age, Anna. My son has had 0 interest in passies since the day he was born. So you just do what you can. And kids do what they want, don't they?
And then we've got some kids that
another
are
question
hiding.
From Ashley. This one is.
Go ahead.
Sorry, we have a delay sometimes, folks, so that gets us hosed up, but that's all right. Ashley has a question as well, and this is another one that's a little longer, so I won't put it up on the screen. But she's asking specifically about recommendations or concerns about sippies, 360 cups, straws, that kind of thing. I think probably a similar answer to the Passy questions on that stuff. But what are your thoughts on kiddos and sippy cups?
I'm glad you asked this, Ashley. This is actually, I think, another one of those surprising things. I think people are generally more concerned about the shape of the cup and the spout and whether it's a straw or it's squishy or it's hard or not squishy and what that does for the shape of the kid's teeth and the bite. But really, my concern is what goes in the sippy cup, because anything that goes into the sippy cup that's not water is doing more damage to your child's teeth than any kind of shape of the sippy cup. So really, in my opinion, sippy cups are generally terrible. And because you can put a beverage in there and then the kid has access to it all day long because it's easy. It doesn't spill. It's available. The parent doesn't have to get up and get another helping. So milk or juice or Gatorade or pop or sweet tea or whatever goes into that sippy cup is doing far more damage in terms of cavities than anything else. And that's why we recommend not doing sippy cups. If you're using it as a water bottle and putting water in there, go to town. You can use it as long as you want to. And then it becomes more of a pacifier question. But generally, kids aren't sucking on a sippy cup like they would a pacifier or a thumb or a finger. It's not generally a sucking habit. And the sippy cup isn't in there long enough to make a really big difference with that. So I think the focus is to be more cognizant of what's going in the sippy cup as opposed to the shape itself of the sippy cup. And I think people are pretty surprised by that generally too. You know, people ask what to give their kids to drink, and it's a really boring answer, but water is the answer. Pretty much everything other than water has some kind of sugar or carbohydrate in it. Milk, breast milk, juice, unless you're talking about sugar-free substitutes, but then you're talking about aspartame and sugar substitute, and that's a whole conversation that I don't feel like I have any expertise on. So they're great for teeth, but I can't tell you what it does for your kids and their health.
Oh, but water. So what, the 2 thumbs up for water for kids.
2 thumbs up for
in
water.
whatever kind of cup you have.
Exactly.
Maria is joining us with another great question. She's saying, when is it safe for my child to have x-rays taken?
That is a great question. We get that a lot as well. And I think this kind of goes back to the difference in specialty versus a pediatric dentist and a general dentist. We try to get x-rays as early as possible because we tend to see cavities a lot earlier than people expect. So the answer for that is, in the front, we try to get it arbitrarily around the age of 3 is when we start having the conversation about x-rays. And it's by a visual exam. If we see something in there that needs an x-ray, obviously we're going to make a recommendation to take that at that time. But in terms of a general screening tool, the front will take a picture of their front teeth because it's a little bit easier on the kids around the age of 3. And then anytime those back molars start touching visibly during the exam, we'll make a recommendation for the back bite wing x-rays. And those aren't easy for kids. They're not a normal thing. Some kids do really well with them and some kids really don't like them. But the benefit they get of having that screening is that we can catch cavities before they become a really big problem. So, and we encourage, you know, the more positive parent feedback we get about those, the better the kids generally do.
Great tip. Another question that came in through Messenger. My partner tells scary stories about the dentist to get my kids to brush their teeth. And I worry it's going to make my kids afraid of the dentist. What do you think?
I mean, that just makes my job harder. I keep referencing my poor professor in dental school, but he used to say, you know, that makes our job harder and your bill bigger. So, I mean, but honestly, the more positive you are at home in your home environment, the better their experience is going to be with us. So we don't want to be the big scary dentist. We want them to enjoy brushing their teeth and coming in and being excited about excellent oral care. And so there are definitely words that don't help us at all and set us up to have a really scared, maybe really challenging appointment if, we're used as a threat or the bad guy or things like that. Now, I'm happy to be the bad guy in terms of telling your child to brush at night. If you don't brush, I'm going to tell Dr. Vaughn you didn't brush your teeth and you better brush your teeth right now. That's fine. But if you don't pick up your room, I'm going to bring you into the dentist and tell them to give you a shot. That's not generally effective for what we have to do. So if you help
Just
us
let the
out,
be messy. It's okay.
Exactly. The more you help us out, the easier and better their experience will be.
Any tips for what do you do when your child is complaining of a toothache? Saying my tooth hurts. What questions should you ask to know if that's a concern or if that's just a kiddo being a kiddo?
I thought that's a challenging question too. I think in general, children are really poor historians. They don't know what hurts. Well, the parents will come in and they say the top right hurts, and then the kid will point to the opposite side, and by the end of the appointment, they're pointing to the front. So sometimes they don't even know what's bothering them or what's not bothering them. But if it's something that they say is hurting and they don't mention it again, it's probably something they ate. A sharp corner of something got caught in there, not kind of a huge concern. If it's something that they're consistently saying that their tooth is hurt, it's hard to look in kids' teeth. But if you can lay them down and get a really good look in their mouth and see if you can see anything in there, sometimes kids will get ulcers or spots on their gum tissues or sore spots or things like that. Obviously, if you see anything that's concerning, call us up and we'll get in there and take a peek at it. But I think it has to do with how long they're complaining about it. If it's something consistent, then obviously just call the office and get an appointment and we can come in and take a look at them. Some things that can occur without cavities, if kids, we'll get a lot of questions about trauma or kids falling down, especially toddler age when they're just learning how to walk and they tumble, and sometimes those teeth or their mouths take the brunt of a hit or a fall. And that's another time where we would take an x-ray to just make sure that nothing's broken underneath, things like that. But sometimes those teeth can abscess and not recover from a fall over time. So even without a cavity or anything in particular, there are various things that can happen with trauma or cavities or things like that. And that's an individualized something that we'll take into account when you're here in the office.
Great information. Well, folks, since we are almost at an hour and we want to respect Dr. Vaughn's very generous time, get in final questions now. So if you have a question for her that you wanted to ask that you haven't gotten the chance to ask yet, now is the time to post that question. While we're waiting, oh man, should we do another joke? I think we should do another joke. So I need to pick a number. I'm going to say... I think we should. Oh, I agree. I'm going to say number, it's the 20th of October. Let's do number 20.
Sounds good. Let's see. Where do you find a chicken with no legs?
A chicken with no legs. The Funny Farm? No.
Wherever you left
how did I do?
You find it wherever you left it because it can't move. That was a bad joke.
Oh, I don't want to. I'm genuinely laughing about this. We have some very nice comments to help us wrap up. Nobody's commenting about how great our joke was, but we do have today Mosher, our wonderful CEO at the Discovery Center, who's saying, thank you, Dr. Vaughn. You're fabulous and provided so much great information. I totally agree. And thank you for tuning in today. We also have a very important question here from Katie. She's specifically asking, who is your favorite employee at Vaughn Pediatric Dentistry? Do you want to weigh in on that, Dr. Vaughn?
I feel like that's a very loaded question. I don't think that one has the right answer to it. I love all of my
Oh,
employees.
we are thrilled to
and
have
they-
folks.
If anyone has had the pleasure of coming to the office, they do a very, very wonderful job, and we enjoy each and every one of them, and they are part of what makes the magic happen here. So they are a very integral part to what we do. And
We are
Katie.
thrilled to have some of your team members who tuned in tonight. That's very kind. Yes, especially Katie. I should put in a plug here for your Facebook page at Vaughn Pediatric Dentistry. They have right now a pumpkin carving contest that I understand a lot of the staff have worked very hard on. Some excellent pumpkins, and you can vote on Facebook. So if you're looking for something fun to do tonight, go on over and check that out. Give them a follow over at Vaughn Pediatric Dentistry because they do so much good work. And speaking of good work, one other thing I wanted to ask about before we log off. A lot of you have probably noticed folks from Junior League around town wearing black dresses in the last few days, and Dr. Vaughn is wearing her black scrubs. I wonder if you want to talk about that campaign that you're helping out with and what's behind that. Fill us in.
I'd love to. So this is our second year of doing what's called the Little Black Dress Initiative. I had a sticker on, but I took it off because the reflection is kind of difficult. But we have stickers that say, ask me about my black dress. I can't wear a dress to work, so I've been in black scrubs. But the idea is just to highlight poverty and to demonstrate that some people don't have the options of looking in their closet and having options of things to wear. So it's just to heighten awareness of poverty and those in need, and we're fundraising to bring awareness to that. So if anyone's interested in donating to that cause, it's a wonderful thing that we do for Junior League. We have a public page for Junior League, and you can access and donate through there. Thanks for letting me do.
And I will be sure to
Laura. That was great. Yep.
Well, we're thrilled with the work that Junior League is doing broadly in our community, and that organization has supported Discovery Center in a lot of ways. We are thrilled to have had lots of volunteers from Junior League here at the museum over time doing lots of great projects. We're very grateful for their support and everything else they do, and grateful for your support as well. We will be dropping that link to donate to that Junior League campaign for Dr. Vaughn in the comments. So if you want to throw a couple bucks her way for a good cause, we'll drop that in the comments, and you'll be able to do that. But with that, I think we will log off for the night. Is there anything that we have forgotten to talk about, Dr. Vaughn, that we desperately needed to share tonight?
Gosh, I think we did a pretty good job covering things. We really enjoy what we do. We really advocate for you and your child's health. And so if it's something that you've just been nervous about coming in, I just encourage you to come in and do that. It's what we do every day, and we try and make you as comfortable as possible.
That's wonderful. Well, thanks again, friends, for tuning in here on our Facebook page, the Kansas Children's Discovery Center. You can find more of these awesome videos on our website at kansasdiscovery.org, where we now have over 150 Discovery at Home activities and some live recorded videos like this. Dr. Vaughn mentioned our Ask a Pediatric Sleep Consultant earlier. We've also had Ask the Pediatricians, Ask the Child Psychologist, all sorts of fun Ask the Experts sections that we'd love to have you check out. Those are all on our website at kansasdiscovery.org. So check those out when you get the opportunity. And of course, follow us here on Facebook for more great content like this. If you have an expert you'd like to have us talk to live on Facebook, let us know. Drop that in the comments or send us a message, and we will look forward to catching you next time. Thanks so much, friends. Good night.